Hello, everyone. Welcome back to our podcast. And today we're going to continue on with our discussion about endometriosis. I have a lovely guest here and colleague of mine, Janna. Janna, do you want to introduce yourself to everyone, let them know what your role is and your kind of experience with endometriosis?
Yeah, so I am one of the registered massage therapists here in Fredericton. I'm also a strength coach at a local gym, so I'm also
A fitness instructor?
Yeah.
So she's multi-talented.
So I'm also a fitness professional. And I've taken it upon myself to do a lot of extra continued education in the perinatal and pelvic health space.
Yeah, we're very lucky that she has such a wide berth of education. So from like a manual therapist perspective, but also from an exercise prescription perspective. And then to narrow that down, to niche it down even further and to be really like women's health, pelvic health oriented. So she's a great fit for this discussion. And you had been telling me about your kind of passion towards endometriosis from both a personal perspective and a professional perspective.
Yeah.
Do you want to speak to that a little bit? Because I think that gives you a lot of insight that not every professional or every patient might have.
Yeah, so I just got my official clinical diagnosis for endo early last year. But as we know with endometriosis, it was a long journey to get there. So if I think back to the first year of menstruating, it would have been sometime in middle school. I can't remember exactly what age. I just know it was around the same age as all of my friends, so nothing super early. But in those first couple of cycles, I actually personally, as like a 13 or 14-year-old, reached out to my family doctor. That was just, that's
your personality?
That's my personality, yeah. A little 13-year-old on the phone asking for an appointment because of their periods.
That tracks with what I know.
Very independent. So I booked an appointment with him, and my main complaints were a lot of period pain and missing time from school. And I was getting really dizzy and lightheaded. And the advice that I got from him wasn't advice that really helped a whole lot.
Right.
I got Yaz birth control. That was the birth control that they just had in office that they could hand out to people who needed it. So he thought putting me on birth control would help my symptoms. And then he told me for my dizziness that whenever I get dizzy, I should stand up and do calf raises to get the blood flowing, which is infuriating to look back on as a 13-year-old or 14-year-old who was really concerned and truly dizzy.
Right.
Just being told, here's a pill and get the blood flowing, right? Move some muscles. So I do remember I also had the complaint of intense breast pain. And at the time, I didn't know that was something that I would experience around my period.
Right.
So I actually was like, I think I have breast cancer. So he did investigate that a little bit for me as well. But he still never told me that was normal to experience on my cycle. So I was left with a lot of gaps. And going forward from there, I didn't have a whole lot of relief, but I also didn't have as much medical anxiety about it because I kind of figured, okay, well, if that didn't help, like he wasn't too concerned, I shouldn't be too concerned.
Right.
So going through adolescence into being, as I was maybe 17, it was end of high school, I was really finding it difficult to function around my period. So things were progressively getting worse. And for me, my main symptoms around my period at that point would be nausea, vomiting, passing out, so having vasovagal attacks.
Yeah.
And I would always ask my partner at the time to just stay close to me on the first day of my period because I felt incredibly unsafe.
Right.
So for me, my menstrual cycles really knocked me out, and quite literally, and left me feeling really, really scared. And I don't remember going back to see a family doctor at that point. It wasn't until I had moved out of the house and came to Fredericton that I lived in St. John at the time, that I actually went to a new family doctor that I was lucky enough to have as a New Brunswicker, and another male family doctor who didn't do anything for me, tried me on a couple other birth controls, still wasn't controlling my symptoms, and he didn't even order me blood work. It wasn't until I got my first female family doctor, because they just switched and like he left and a new female came in.
You like lucked into having a female practitioner.
And
okay.
she was my first doctor who really took me seriously. And she ordered blood work for me, and she gave me a couple tips with medication and NSAIDs and how to use them more effectively around my periods. And then she finally gave me a gynecology referral. So that would have been 3 years ago that I got my gynecology referral.
And this started when you were 13 or 14 years old?
Yeah, somewhere in middle school. Yeah.
Wow. So firstly, thank you for sharing that story with us. Secondly, I think that it sounds all too familiar with other stories that practitioners have heard about the length of time that it takes to receive a diagnosis and to even feel like you're being taken seriously sometimes as well. I've got so many questions to ask you. I think it was very interesting that you said you felt unsafe, because I think that that's not something that's necessarily spoken about very much. And I think that was interesting that you have the personality type that as a very young teenager, you were advocating for yourself already in a health sphere where you would not see a lot of, well, you were a child, where you would not see a lot of children doing that, right? And that would be difficult to do even with informed consent from parental guidance, right? And being of age to make informed consent. So it sounds to me like you're already someone who was willing to try, like you were making an effort to try to seek improvement. And even then it took that period of time for you to get an official diagnosis. So have you, since that time, how have you felt navigating the medical system, and have you found treatments that have been effective for you?
Yeah, so for me, when I got the gynecology referral, my family doctor ordered a couple ultrasounds. So I had one that was like vaginally, and then the other that was like an abdominal, or maybe that's a pelvic ultrasound, but one externally and one internally. Yeah,
so there are abdominal ultrasounds, like abdominal pelvic ultrasounds, or intravaginal ultrasounds. And for people who don't know, they have like a little ultrasound head that goes up in vaginally, which is always an interesting experience for people.
Every time I thought that she was done, she's like, no, just one more inch, more photos, and it just never ended. But yeah, so I mean, once the gynecologist saw those ultrasounds, and then learning about my symptoms, which at the time had developed into really lightning bolt sensations trying to use the washroom with either urination or defecation, which was like agonizing. I would scream falling off of the table, like not off of the table, off of the toilet. Just trying to use the washroom, and it was just too painful to let things relax and do so. So definitely some spasming happening. And I had recently vomited at the time, hadn't recently passed out, and then really heavy menstruation. So some of the things that we talked about with the gynecologist would have been birth control or some form of contraceptive, as well as more strategies with NSAIDs. But for me, the biggest thing that has helped my symptoms has been to try to desensitize my nervous system, downtrain my pelvic floor, and then find more pain management strategies for day of. And that's been really empowering, instead of just sitting there feeling like, well, I tried my heat pack and that's not helping. I've taken my bath and I feel dizzy. So, I mean, what else is there? So finding, most recently, I found a new topical cream that I really like that I've now ordered more of, and I'm going to spend more time seeing if that actually continues to make a difference. But then using TENS machine has been really helpful. And playing around with placement of the pads too to find what might work best for me. As well as different stretches and down training exercises. That's really been the most helpful thing for me. So you've got like this toolbox that you've built. Yeah, more of a toolbox.
It's interesting, I didn't want to interrupt you, but you really highlight like the textbook of the spectrum of different types of symptoms that you can experience, because I don't know that everyone is innately aware that you can have pain with defecation and pain with voiding, so like poo and pee, that those can be extremely painful during your period. And where you can we can cut out parts if you don't want to share them. But were your symptoms only during menstrual bleeding? Were they leading up to the menstrual week? Were they non-cyclical? Have they become more chronic in nature?
Yeah, for me, a lot of it has just been around day 1 to 3 of my cycle. However, by the time I got in to see the gynecologist early last year, things were starting to kind of extend out.
Right.
To maybe the 5 days leading up to and the 5 days after day one. So yeah, so things were starting to kind of spread out more.
And I think that's what Janna was talking about, where she was talking about like reducing the activity of the nervous system and reducing her pelvic floor. We will see that clinically, that when pain is unregulated for a long enough period of time, that you can see the cyclical pain, which is pain that happens, at a kind of predictable time each month, become non-cyclical, which is where it starts to be more chronic in nature. So now it's up to a week before the period. It's during ovulation as well, so it becomes more and more and more. And that's really where we're seeing, where we want to advocate for finding ways to deal and cope with the pain so that we don't have this non-cyclical pain start to develop. So you mentioned a variety of treatments that are awesome. Like, you've really developed your toolkit, and I think and you're a professional in this industry too, right? And so it's taken this much time for a professional who understands this to seek treatment and get access to treatment, and then figuring out the toolbox that's going to work. For a layperson who has no training in this whatsoever and maybe doesn't have access to care, you can see how it can be so challenging. Yeah. So you mentioned that you're using a TENS unit, which is great. So that's little electrodes that are placed on the abdomen or the low back or different areas. And you're saying you're still playing with pad placements, right? Yeah. So clinically, professionally, we recommend kind of like low abdomen or along the spine where the uterine nerves come out. Are there any other areas that you have found that work better for you?
No, I think I've played around with more back placement and haven't found it as helpful. Yeah. Except I find sometimes I will have a cycle where I feel like it is more in my back.
Right.
But most of the time I do feel things more so through my, like the front of my belly and my core. Yeah. So I do find placement in the front a lot more helpful than placement in the back, but I am open to trying around depending on what's happening.
And that's so amazing, right? Because some people will try TENS and they go, it didn't work. And it's like, well, there's so many different ways that you can set your TENS unit, and there's so many different electrode placements. And unfortunately what happens is you only get 3 days to practice, during, and then you have to wait another month before it happens again, right? Yeah. And you talked about pelvic floor muscles, and I know that at this point you've a lot of education about pelvic floor muscles, but are there certain exercises or stretches that you find more helpful?
Yeah, I mean, I will say, so for me, I did start with pelvic floor physio. I felt like my pelvis, I had disassociated from it so much. It took me over 3 months to really learn how to do a pelvic floor contraction, and that was with internal feedback from pelvic floor physio. So once I could learn how to actually work with those muscles, I don't find that one thing really, and this is where being a professional kind of comes into play. Like I get to play with it day after day, depending on what my symptoms are. So sometimes being in like a puppy pose is really helpful if I'm feeling a lot more tailbone pain. And other times like a happy baby is really helpful for me as well, right? Like it just really depends on where I'm feeling the majority of my symptoms. And I really kind of alternate through maybe 10 different exercises.
So not this magic bullet. You're not going to do like this pelvic floor stretch and all of a sudden it's going to cure. Well, pelvic floor physiotherapy, all these things don't cure endometriosis too, is the other thing to say. We're not treating the endometriosis lesions themselves. We're trying to treat the secondary symptoms associated with it, right? So when someone's in pain for long periods of time, you'll start to see that the muscles can come into greater tone in the abdomen, around the pelvis, and the glutes, the thighs. And again, like classic presentation where we say, a lot of women will say, I don't feel like I'm connected to my pelvic floor, or I don't feel like I can feel my pelvic floor. And that, of course, like we can't see the pelvic floor, right? It's very, well, you can, but it's very difficult to see your own pelvic floor. As professionals, I can't show you mine. So visual representation and learning is different, right? If it's my hand, someone has pain in their hand, I can open, like I can demonstrate, right? And you can visually see that. If I say, oh, please lengthen your left puborectalis muscle, like it's not even a muscle that it's socially acceptable to talk about in polite company sometimes, right? And so I do find that that people have very poor mental representations of how their pelvic floor functions. And so just learning how to squeeze the pelvic floor and then relax the pelvic floor is a really big goal to accomplish.
Yeah, I mean, one thing that I really benefited from in the last 6 months, I'd say about 6 months would be, when I'm practicing relaxing the pelvic floor at home, I'm now especially on really painful days, I'm now in a side lying position with my hands physically on the area that I'm trying to relax, and giving myself that little bit of external feedback has been really helpful, especially when you're just quite literally curled up in pain. It's hard to just be like, okay, I'm just gonna breathe, and as my diaphragm descends, my pelvic floor will naturally descend. Like, I need that extra feedback, which wasn't something that when I did pelvic floor therapy when I did pelvic floor physiotherapy the first time, it wasn't a tool that I was given.
Right.
So that might also be why I struggled for so long, is because when I was home and in pain, it was so much harder to actually implement it. Yeah. Physically feeling the area in a side lying position has been really helpful for me.
That's a really good tip, because I think you're right. Again, like if we go back to most people don't have a good awareness of that muscle. If you're in with your physio and they're doing intravaginal work and you can physically feel something, that's great. But if you can't replicate it, one, on your own at home when you're not in pain, who cares? And then you have to be so comfortable doing that you can do it even while you're in pain, which is another skill. And so giving yourself, like, it's funny because I find a lot of clients, and you probably have this experience too, don't realize that you can feel externally the pelvic floor moving. So if you find your like sit bones in your bum cheek and you go internal to that, so we usually say like east of the anus is what we call it at our clinic. You go there and you do like a little Kegel and a relaxation, you should feel a little bit of movement into your fingertips. And then learning that skill is a great way that a patient can then check in that they're doing the homework properly when they're back home independent, when they don't have a little physio sitting on their shoulder, right?
Yeah, and as a massage therapist, my tools are even more limited, right?
Yes, so please speak to me. Please speak to me about massage therapy, because do you use massage techniques for your own management?
I've certainly done like my own that I would never do with a client, but my own pelvic floor releases.
Right. So like internal stuff.
Yeah, yes. Something that I would anticipate from being in a pelvic floor physio.
Yeah, so physios will teach you how to do that. But what's so great is that, because we do refer out to massage a lot, what's so great is that when we have a competent massage therapist that knows how to do the external stuff, or that can check in with our patients, be like, are you doing your internal stretches? And can kind of give that feedback and that reminder to do it.
Yeah.
So externally then, what do you find as effective treatment? Because you work with clients who have endometriosis as well, and you probably notice that there's increased tension in different areas.
Yeah, so I mean, I think it depends on where people are, where they have their holding patterns. Right. But overall, we're going to find their abdomen, their glutes, their adductors.
So inner thigh, groin area.
Inner thighs. Anything from kind of the chest bone to the knee can be extra locked up. We could even go above that and say all of the respiratory muscles, right? Yeah. So I mean, there's a lot that we can work on that's kind of standard amongst all RMTs, whether they have extra education with endometriosis or not. That just kind of makes sense.
Yeah.
And then beyond that, I find myself trying from an external perspective to get people to start to connect with their pelvic floor. So maybe I refer them in for pelvic floor physio, but they're not going to be in there for 3 weeks. So let's put a towel between our legs and start to feel some external feedback when we try to lengthen the pelvic floor as well. Or sitting on a massage ball between the sits bones and the anus, right? Things like that to really try to release things externally.
Oh my gosh, you make me so happy.
Oh. So I mean, that's kind of one of the main approaches. And then one thing that I have done would be administering questionnaires, right? Like to measure the amount of sensitization that someone has.
Do you want to speak to that a little bit? Like what you mean about sensitization?
So I mean... Oh, okay. So I haven't had to...
I know. It's funny because Aaron asked me to explain, I think, like somatosensory pain or motor autonomic pain last time. And I was like, oh gosh, I hate explaining this. But essentially is that kind of like what we were speaking to earlier, when you're in certain amounts of pain for an extended period of time, you'll physically see changes happening in the nervous system.
Yeah.
And so a lot of people, like the myth I find out there is that, oh, you've had pain for so much, for such a long time, you should just be used to it now, right? Like a lot of people think that you get better and better at coping with pain just like based on just the fact that you are in pain for long periods of time, which is not necessarily the truth. And sometimes we actually see the opposite happen, is that when people are in unregulated, uncontrolled pain for long enough, we'll actually see the nerve
worse.
Yes.
Worse. Yeah.
So like the analogy that we're often taught when we're learning about this is that it's almost like the nervous system volume will turn up when you have an input that it will kind of trigger a pain response. And it's funny because we can get really into the weeds in this, but pain is like, everyone's like, well, your pain receptors. You don't have pain receptors. You have nociceptors, which are things that predict like changes in chemicals, changes in temperature, changes in mechanical pressure. And that information comes into the body, kind of computes starting in the spinal cord, and then it computes and processes even more in the brain. And then we have this ability to like turn down the volume. But all of that system can kind of get dysregulated when you've been in chronic pain. You've had pain for extended periods of time. And so this is what you're speaking to, I think, if I haven't overstepped, is that you're talking about techniques to kind of revert those changes, those maladaptive physiological, like neuroendocrine physiological changes that we see happen back into a more calm state.
Yeah, absolutely. Yeah.
So do you have like some favorites that you use clinically to help people do that?
Yeah, well, I mean, it's really tricky because when you're trying to help people in chronic pain, they get stuck in this pain feedback loop of, you know, I think these things would be helpful for me to do, but I'm in pain, so I can't do them. But since I'm not doing them, I don't think I'm getting out of pain.
Right.
Right? And
from
so
the hamster wheel.
Yeah, and so it's really hard to just tell people, you know, well, exercise might be helpful. Why don't you go for a walk? Well, it's like, well, I'm passing out and vomiting. I can't exactly go for a walk.
It sounds almost like gaslighting.
Yeah, it's
right?
like medical gaslighting, right? So I think that one thing I really appreciate about massage therapy is that passive modality is the expectation, right? When a client comes in for an appointment, they are expecting passive modality.
That someone's going to do something to them, basically, right?
And that takes a little bit of load off right away for people.
Right,
because
like you've got someone to help.
You've got someone who can physically help you instead of say, here's the things I think you should do. Bye, see you in a month.
That's
right?
a really good point. Thank you
so,
for highlighting that.
Yeah, and so I mean, we can really help to get people started and create a little window of opportunity that might be motivating for them to actually do a couple things when they go home that might be helpful for their pain.
Yeah.
Right? And so I do really appreciate massage therapy for that option.
I think that's an excellent point. I think like you're looking at like what a comprehensive endometriosis team looks like, right? Yeah. So you've got your family physician that hopefully is going to guide you to the correct practitioners. You've got a gynecologist that's going to talk about the pharmaceutical or surgical management. You've got pelvic floor physiotherapy that's teaching about your muscles and your anatomy and coming up with strategies. And then you've got manual care therapists, so massage therapy, sometimes chiropractic, osteopathy, acupuncture we see very helpful. That's helping you build that toolbox. And what's nice about the people like us, like allied health professionals, is that we tend to be able to see our patients on a more regular basis than getting in to see a physician or a specialist, right? So you've got someone that's there kind of holding your hand through this whole process, right? Which can be very isolating and can make you feel really alone. And when you see it coming down the tunnel each month, it can be very overwhelming.
Yeah. And I mean, you were saying earlier how my experience kind of speaks to that of a lot of women and what they've been through, but we can extend that even further and say my situation may not have been ideal, but I still had so many things going for me that were helpful. I didn't have to face extra medical racism. I didn't have to face transphobia, fat phobia, right? All these other intersectionality layers that make access to care even worse. I had a family doctor. I don't have one anymore, but I did at the time, right? So things that could really get the ball going for me. And I was a good advocate. And I have people that I can talk to about my endometriosis. And I'm a health and fitness professional.
In the space of women's health.
Yeah, right? So I've had all these other things going for me that are helpful. And if we think about someone who doesn't even know what endometriosis is, who's at home suffering, who doesn't even know how to start the conversation in a doctor's office, if they even get into a doctor's office, right? So, I mean, our clinic becomes extra important to someone's care, and the more information that we can give them and the more advocacy that we can give them and the more access to care that we can give them, the better, right? Because
well said.
We can do a lot, even if it's just suspected endometriosis.
Just highlighting that painful periods are not normal and maybe they should seek medical care. Maybe we can help them in directing them to the right people. It's funny because I think that like you've hit the nail on the head there. And I had another staff member, we were talking about this, and she was saying, I didn't realize that being in a health setting was so useful to my everyday life. Like, I didn't realize that when I hurt my back or when this happens, that I know what to do. And that when I have a medical condition, I have the tools and access to people that can help me manage these things, right? And I think that we're very fortunate because not everyone has that medical literacy or that healthcare literacy, and not everybody has access to care. And so I think that's why when you have practitioners that are incredibly passionate and appreciative and they want to share their skills, I find most people who work in women's health, like you have to go through a lot of different things to work in women's health. And so I feel like usually that's a very, impassioned practitioner who's there to help. And so people are very lucky to have access to you. Is there anything that you'd like to say in closing?
In closing,
yeah.
One thing that I haven't highlighted that I think is worth highlighting is that people with endometriosis struggle in all aspects of their life, right? And I am so fortunate to work in a place like this where if I needed a day off because of my menstrual pain, that's not a problem, right? But I've even been in other healthcare environments where I've had other female workers look at me and raise their eyebrows and say, well, I have a period and it doesn't stop me from coming into work, right?
Right.
So we're so incredibly lucky here. And the more that we talk about endometriosis or menstrual health in general, I mean, the one thing that has populated human, like the one reason humans exist, right, is such a hush topic, taboo
subject to discuss, right?
Yeah, if it wasn't for our periods, if it wasn't for menstruation, right, we all wouldn't be here.
They're
today.
Necessary for repopulation of the earth. Yeah.
So the more that we talk about it, I think the more that we can all
normalize it, get it out there. Yeah, I think that that's a really good point, and I think that we're starting to see that a little bit with these programs, with there being menstrual products in government buildings and libraries. We see so many drives now for feminine hygiene products, for people who experience poverty and trying to just get access to feminine hygiene. Yeah. Like things that people don't necessarily think about, right? Yeah. Just these additional challenges that we experience, and if you have to use 5, 6, 7 products a day, that you will go through that. Like that's a financial burden that not everyone can afford. And you're right, it keeps girls home from school, it keeps girls home from work. Which is not something that we want to see, right? And so I'm hopeful that we will actually see these symptoms be addressed more thoroughly at a younger age. And I have seen that clinically, that more and more we have teenagers that are being sent in for care to potentially learn how to use a TENS unit so you don't have to miss your high school dance, right? Yeah. Or that you can play on your sports team, or you can go take that test and the exam. You don't have to do a rewrite in a week's time. And that we're seeing this managed in a much more, what's the word I'm looking for? Not preventative, but much more we'll get ahead of the symptoms, right? Mm-hmm. As opposed to waiting for things to get so bad. It's okay, now we'll send you to the doctor. Now we'll do those tests. It's no, we're trying to be much more of an advocate for getting treatment early on and preventing that non-cyclical pain from coming in. So, anything else, or we covered the most of it?
I think that's good.
Well, thank you so much for your time. I so greatly appreciate it. I think it's so helpful for people to hear someone who's got experience as a patient and as being a practitioner in this sphere. So thank you, and I'm sure we'll be seeing more of you on our social media and podcasts.
Absolutely.
Bye, everyone.